Hey guys, I am the nurse doc tutor agent, and today we will be going over levels of prevention. So if you are struggling with understanding primary, secondary, or tertiary prevention, then this video is for you. But do not be selfish. Share it with all your classmates so you all can pass your exam. Let's get started. So there are 3 levels of prevention. So let's talk about primary. So primary prevention, that is going to focus on promoting health and preventing the development of the disease. Okay, so we want to think about it like this. When it comes to primary, the person does not have the disease yet. So we want to prevent the patient from developing the disease. So things that we could do is immunizations. So this would be patients taking the flu vaccine. Let's see, family planning and services. That would be suggesting that the patient wears a condom during sex to prevent them from getting STDs or getting pregnant. It could be poison control information and accident prevention education. So the key to remembering primary is that the patient does not have the disease yet, but we're wanting to prevent them from getting it. The next is going to be secondary, and that's going to focus on screening for early detection of the disease with prompt diagnosis and treatment of any found. So, example of this is assessing children for normal growth and development and encouraging regular medical, dental, and vision examinations. So, one thing about an easy way to remember secondary is to remember screening. So, anytime we start to do specific exams for this person, then that's going to be secondary. Another thing to think about it is when a patient starts to exhibit some signs and symptoms, and that patient starts them on prompt diagnosis and prompt treatment. So let's say that the patient went to get their blood pressure checked at the clinic, and then the clinic then said that, okay, you have high blood pressure, so we're going to start you on some blood pressure medicine. That's going to be secondary prevention. So it's going to be leading to prompt diagnosis and treatment of any found. Then your last one is tertiary. It begins after the illness is diagnosed and treated. So the goal is to reduce disability and help rehabilitate patients to their maximum level of function. So examples of that is teaching a patient with diabetes how to recognize and prevent complication. That is going to be a patient going to physical therapy to prevent contractures. If a patient has spinal cord injury, that's going to be them going to physical therapy. So also could be a woman who attending a support group after the removal of their breast because they had cancer. So remember, when we have tertiary, we want to think of is the patient has already been diagnosed, right? They already have the diagnosis and they already have started the treatment. So our goal is to reduce any disability. So another one could be, let's say that a patient has been diagnosed with diabetes. So we want to make sure that that patient knows how to administer their insulin, that that patient knows the foods that they shouldn't be eating, and all those things to prevent that patient from losing their toes, you know? So that's going to be tertiary. So remember, primary prevention, that's going to be the patient does not have the disease at all. Our focus is going to be education, and you can give vaccines, and that's going to be for prevention. Secondary, now we're about to do a focused screening for early detection of a disease. So let's say a patient then starts to complain of, feeling dizzy and all that kind of stuff like that. And then they go to the doctor, and the doctor then starts to draw all these labs on them, starts to get their blood pressure, and then it comes back with a diagnosis of hypertension. Then that patient will be in secondary, where they'll be started on medications and things like that. So remember, it's prompt diagnosis and treatment. Then our tertiary prevention, the patient has already been diagnosed and treatment, but our goal is going to be focused on rehabilitating that patient and reducing any disabilities. So now let's put what we learned into practice. Let's do some NCLEX questions. A nurse is educating a community about healthy lifestyle choices to prevent cardiovascular disease. Which level of prevention is the nurse implementing? Is it A, primary prevention, B, secondary prevention, C, tertiary prevention, or D, none above? So I'm going to give you some time to think about it. If you chose A, primary prevention, then you are correct. So remember, with primary prevention, we are going to be educating to prevent the patient from actually having a diagnosis. So in this scenario right here, the patient does not have a diagnosis. So we're going to be just educating them to prevent it. So that's going to be primary. A nurse is working with a local health department to implement a campaign that includes encouraging individuals to get vaccinated against influenza. The goal is to reduce the occurrence of the disease within the community. Which level of prevention does this activity represent? So I'm going to give you some time to think about it. Is it A, primary, B, secondary, C, tertiary, or D, none of the above? So if you chose A, primary, then you are correct. So remember, the whole goal of primary is to prevent, and vaccines are a part of primary prevention. A nurse is conducting a program that offers free blood glucose screenings to individuals who have a family history of diabetes. The purpose of this is to identify people who may be at risk for developing the condition so they can receive early intervention. Which level of prevention is being implemented? Is it A, primary, B, secondary, C, tertiary prevention, or D, none of the above? So I'm going to give you some time to think about it. But if you chose that this is secondary prevention, that you are correct. So remember, with secondary prevention, that's when we're going to start doing screening. So that should automatically jump out to you. Like if it says screenings, then it is secondary. So we want to be able to early intervene on a patient, and it even says that in the question. So that's going to be secondary. A nurse is conducting a screening for hypertension at a health fair to identify individuals who may need further treatment. Which level of prevention is the nurse providing? A, primary, B, secondary, C, tertiary, or D, none of the above? If you chose secondary prevention, then you are correct. So remember, with secondary prevention, that's going to be when we start to do our screenings, okay? And also, once we get our screenings back, we can start prompt treatment, all right? A nurse is providing rehabilitation services to a patient who has had a stroke to help them regain function and independence. Which level of prevention is the nurse addressing? Is it A, primary, B, secondary, C, tertiary, or D, none of the above? So I'm going to give you some time to think about it. If you chose tertiary, then you are correct. So remember, doing this type of prevention, we're going to focus on that patient regaining as much independence and preventing complications and things like that. So I hope you guys got this one correct.